Good afternoon and welcome to the HL7 Europe webinar on the HL7 Europe Imaging Study FHIR Implementation Guide and how to contribute. My name is Michael Struben. I will be your host and moderator. This webinar is the first webinar that we're hosting that is part of a new webinar series that we're inaugurating with this webinar here on the theme of the EHDS FHIR IG ecosystem. In our meeting today, we want to go through one implementation guide specifically. We want to tell you a little bit more about how you can contribute. And we also, of course, want to discuss the policy context here. So we have a stellar cast of speakers. We have Line Andresen-Seele from HL7 Norway, who wears many hats, and she'll tell us that in a minute. Georgia Kanjoli from HL7 Europe, and Bas van den Heuvel Phillips. I didn't coordinate with you how I pronounce your name. I hope that was fine. And of course, I will be your facilitator. Before we get started, just a few items on housekeeping. You are all automatically muted. But you are empowered to use the chat, and I want to encourage you to use the chat to pose your questions, make comments, say, hello, stop, can you please answer this question or so, or even raise your hand, or you can give us your emojis, your thumbs up, or your laughing sign or so. This is the way you can become part of this webinar. We will have one or two or three times when we want to pause for questions. If you then have a question, if you'd like to speak, then please raise your hand and we'll try to accommodate you. We have some timing. We want to, of course, manage time, but if you would like to speak and we have time, then we will unmute you and we'll also allow you to do your video. And if that happens, then please tell us who you are. Yes, and the webinar will be recorded, and the link to the recording and the slides will be made public on hl7.tv, and you will receive an email with the specific link when it's available. You and alongside everybody else who registered, who may not be able to show up, but who's registered. And with that, I would now like to quickly review the agenda, but I've already kind of outlined this. And without further ado, I think I want to now hand over to Line. And Line, I think the floor is yours, and I invite you to take control of the slide deck. Go ahead.
Thank you, Michael. So I'm here to talk a little bit about the policy context of EHDS. I'm not going to make a thorough presentation of EHDS, but perhaps put it into context for the rest of the presentations that you will hear on this webinar. So a little bit about me, or my hats, as Michael says. For my day job, I'm actually an enterprise architect at the Norwegian Institute of Public Health, where I work with a lot of EU projects. My background is technical. I'm a Master of Cybernetics from the Norwegian Institute of Technical Subjects. I'm also the representative from Norway at the eHealth Network Technical Subgroup, which I will talk a little bit about later. I'm also chair of HL7 Norway, and I'm currently the affiliate director of HL7 International. I do have several other hats in HL7 as well, being very much involved with HL7 since 2009. So a little bit about HL7 Europe, because people tend to think about HL7 Europe as an organization, but that's not the case. HL7 Europe is an organization that kind of coordinates the work that we all do. It's not just EU, because Norway is actually not a part of EU. We are a part of the EEA, but HL7 Europe is all of us. We are a collaboration of all the European affiliates. And if you're not having an affiliate in Europe, you could see that not all countries have one. Please reach out, because we will love to have you as an affiliate. But do remember that we are all a part of the European community, and we all need you to bring HL7 FHIR into the European health data space. So basic about your electronic health data space regulation. It went into effect the 25th of March. And for those of us that are not a part of EU, it will start processing how to sign up for it after the March. So I think Norway is well on the way into the European health data space. So HDS in a nutshell, it's about primary use of the data delivered of healthcare, a lot of regulation about the patient's access to their health data. They should be able to access it rather immediately after health encounter. It's also about seamless exchange for continuity of healthcare for the patient and also for the clinicians. It's about secondary use of data for research and public interest, like my institute have a lot of work on these days. And there's also a lot of requirements for the EHR systems. Our goal is to create a single market for EHR systems. So a short overall timeline for the application, as you can see here, there is no like a start date that says directly now everything should be in production. So for the primary use, you can see here it's 2028 where the exchange of first group of priority categories will turn into to law. So basically, those country that hasn't started still has some time to start the work. I'm not going to go into this, but it's a nice slide to have, and you will have access to it, as Michael stated at the end of this presentation. So directly into the EHDS policy, Article 13 says something about the registration of electronic health data. What I wanted to point out about this slide is number 4 here, that says by 26th of March 2027, the implementing act shall start. And that's where HL7 comes in. Because for now, the EHDS doesn't specifically say anything about standards that should be used or how the data should be transferred from A to B, but still this is going to be stated in the implementing acts coming in 2027. That does not mean that the work, we are waiting for the work to come to us. We are still seeing that we should start the work immediately. And to say a little bit about how EU works on this, I've put up the comparison about eHealth network, the subgroups, and the current My Health at EU governance. As you can see here, the eHealth network is on top with the subgroups of semantic, technical, and coordinated action. As I'm saying, I'm one of the representatives sitting in the technical subgroup. We also have several different groups, as you can see below here. And EU doesn't look into making everything new when it comes to the European health data space. So what they want to do is use the same grouping for EHDS and kind of looking into making eHealth network the EHDS board, covering both primary and secondary use. And the subgroups are to be established by the board, likely mirroring the current subgroups, plus one for secondary. As you can see here, we are also looking into maintaining the same steering groups for My Health at EU and Health Data at EU. So we want to put this into the actual work going on today. So the European Electronic Health Record Exchange Format has several projects that we are working on today. I hope many of you actually are participating in one of these groups. If you're not, please contact your country and see if you can be able to participate in the work. But we wanted to point out one important project for us going on now, the extended DHR joint action, where we are seeing a lot of important work connected to HL7 FHIR. That's been said, HL7 FHIR is also used across all of the other projects. So do not think that this is the only one. We're just pointing it out. There's a lot of important work going on in extended DHR, many hearings right now. So please pay attention if you want to be a part of this work. Because extended DHR are already referencing HL7 FHIR, what I tend to say all over, because they are pointing to HL7 FHIR and want you all to use it. Please join our work and please contact us if you want to be a part of this work, but have problem finding the correct people to reach out to. And over to you, Michael, or perhaps Giorgio. I think questions are at the end.
Yes,
now?
Indeed. You have a question slide here. I haven't seen any questions here. I've put in the chat a couple of questions for our audience to react to, and I'm seeing already a few thumbs up when I asked who else actually knows HL7 Europe, has been to a meeting or is affiliated with a national affiliate, but I haven't seen anybody. Don't lean back and just consume. Please be part of this webinar. We're keen to hear your questions. I think the essence of what we're trying to communicate here is that there will be, of course, implementing acts for from the European Commission to define the specifications for the EHDS, but work is already going on, and HL7 is part of this ecosystem, so to speak, that is working and is developing these specifications. So we are not always aware of, and we're not at the table here, when not everybody is in the kitchen where the specifications are being cooked. A lot of this work is done in some EU projects, but there are opportunities like what we're trying to do today, where we're trying to tell you or share with you some of the aspects of the work that's being done. Are there any questions or comments before we go on to our next speaker? I haven't seen any.
I will be able to take questions at the end too, if there is anyone reaching out during this next presentations.
Then let's proceed now. We have a big fat Q&A at the end of this of our presentations here, but you were a stellar performer, Line, in sticking to your time. So let's move on quickly, so we have more time at the end, when hopefully some of you may have will unleash your questions on us. And with that, I invite Giorgio to take control and take it from here. Giorgio.
Hello, good afternoon, everyone. Giorgio Cangioli, technical lead of HL7 Europe. So I hope that I've been able to move to you see the focus priority category slide. I assume that, and so I hope so. So when what we speak about the ecosystem, we are referring to the well-known priority categories that are mentioned in Article 14, that are those that are mentioned there. And as mentioned before by Line, the actors that are currently engaged in that context are several with different roles in order before arriving to what will be the formal step in March 2027, that is the implementing act delivered by the European Commission. Just to continue about contextual information, we need to remind that the format and the regulation is not only for cross-border. Cross-border is one of the use case, but the solution that we need to work on need to be able to be applied in the national level in different possible scenario of usage. So in that context, where HL7 Europe can, we believe that can have a value. HL7 Europe is able to offer a neutral platform where to engage different kind of stakeholder, including the different initiative and project that are dealing with the format, and offer open, transparent, consensus-based process to develop this standard. And this is actually what we have tried to do, so that the solution that we are trying to propose is a solution that is based on standard, and this is what we'll go and look more in deep later on. Offer a solution that is also flexible, covering the different aspects and needs that I mentioned before, the cross-border, the rules that apply widely across Europe, and also a rule that could be national specific to comply with the jurisdictional expectation. And the solution that we have designed fulfill all these expectations. I can hear some of you that say, oh, but why we need to look to all these kind of different specifications? Why not only one? The point is that everything has been built in such a way that if you comply, for example, with the national rule, and this is the thing that you need to look at, then automatically you comply also with the European rule. So you don't need to look to 5 different guides. You can just look to the guide that apply in your context. And this, you inherit all the rule from the ecosystem of guide. So this is what we are going to talk about. This describes the different guides that have been or are being developed in HL7 Europe, but with the contribution of all the initiatives and projects that are there. These include XTHR, include the different other projects like Share, and different kind of community and organization. And that led to that structure of guide. So we have some common part that apply, that include this code base or core profile that can be applied in different use case. And then we have the use case specific. So how to design an hospital report, how to specify a patient summary, a lab report, a medical imaging report. That is what Bas will explain more in depth later, and then the prescription and dispensation. We try to give support for both release 4 and release 5. For some of these guides, we have been able to publish already both version of the guide for both versions of FHIR. In other, we are starting with that version with a plan to also cover other. As you can see, lab report has been already published. The first version was published last year. As I mentioned, the part of the medical imaging is currently under ballot, and this is what we will talk about more in depth later. And then, starting from next week, also the prescription and the hospital report will be in ballot, while the patient summary, European patient summary, the work is ongoing. So just to give some references, the extension package is released. You can find only one guide under HL7.EU FHIR extension. This is written release 5, but this covers both release 4 and release 5. So for technical people, you can go there and download the package that apply for your FHIR version. The base and core profile cover we have two guides, one for release 4 and one for release 5. And this is what is under the ballot. So the ballot started June 1st and will end June 30. So if you have note, comment, feedback to provide on this guide, please do. Then we have the lab report that, as was mentioned, has been already published. We have in the version, we have already published the version 1.1 of that guide. Then we have the work that has been done in cooperation with HE. HE cover the global part. So if you go to the HE profile on the MPD, you can find the release 5 version. And then we have the 2 versions, release 4 and release 5 of this guide. And the ballot will start June 50, so next week. And to conclude, we have then the hospital discharge report part. I hope that you are still seeing my screen. I see something strange in my screen. So then we have the hospital discharge report that is under FHIR.bill.hospital discharge report. Also, this will be start the ballot next Monday. And as I was mentioning, the ballot, the patient summary that is currently under development, even if it's a very good situation. So we hope that we can proceed for balloting also for that guide quite soon. This is just a summary of where we are. In orange, the foreseen ballot period in HL7 Europe, compared with the stakeholder consultation that is in some cases going to happen starting from next week, and in other cases will be in July or in September. I'm mentioning that because the two are strictly interconnected, because obviously the implementation guide need to fulfill the requirements that are defined and agreed by the XTHR project for these different domains. So this is a little bit of overview of the ecosystem and of the timeline. So I will give back the floor to Michael and to go more in deep on the imaging part.
Thank you, Giorgio. I think this has been great. This has been great, and there are no additional questions here. We've had a side conversation about Brexit. Brexit is the gift that keeps on giving and is such a waste of everybody's time, isn't it? We would hope that we could just at some point live without the issue, shouldn't we? John, I don't know whether you want to bring this conversation to the to I think the plenary. But in the absence of any other questions specifically on Giorgio's discussion of the imaging of the implementation guides currently out for review, let's save any questions perhaps also, and we're making perfect time. I think you too, Giorgio, stuck to your issue. So Bas, I think I'm going to hand over now to you and invite you to take over control. And if you have any additional questions or issues or would like to give us a specific a visual experience or so or online, please feel free, because it seems like we're making really good time. Bas, over to you, and please take control.
Thank you, Michael. As I indicated in the agenda, I'll talk a little bit more about this imaging study report IT. I have trouble changing the slides. Yeah. Like Giorgio says, this is currently on the ballot, so I'd like to invite you to take a look at it and provide feedback. Please note this is the first version of this IG, and we plan to have significant updates in the future. But we want to get early feedback to know whether we are on the right path. A little bit about me. My name is Bas van de Heuvel. So yes, Michael, you pronounced my name pretty close. I work as a standardization architect at Philips. That means that I represent Philips in healthcare related standardization organization, specifically HL7. I've been active in HL7 since 2017, mainly on infrastructure topics, context synchronizations, launch of smart apps, and many other topics. I've been the co-chair of the HL7 EU Imaging Group since January, and I'm trying to get together with Mark Kammerer to get this IG up for publication in the time frame indicated by Giorgio. So what has been done? Well, this activity started in January. It's a joint activity between HL Europe and HL7 Europe, although currently the specification is published under the HL7 Europe flag. And in January, we start with an initial version based on the guidelines we call from the eHealth Network project. And we also took the input from the IT project IDR, Imaging Diagnostic Report. And basically, based on two input, we created a first version of the ID, which we discussed and aligned on with the people present at the HL7 EU Workgroup meeting in Lisbon in February. And between February and May, we discussed improvements on this IG and weekly telcos with a large community. And in May, we took the version we had and created some first tests on that on the HL7 Connecticon in Madrid, based on feedback from the Connecticon. And we published the first version for ballot at the end of May. And the ballot is open until the end of June for feedback. That doesn't mean if you provide feedback afterward, we won't take it into account. It's just that that's the formal period where we say this is the feedback what feedback we get in this period we'll take into account, and what happens afterwards might or might not be included depending on the time frame. In 2 weeks, the end of June, there is an IHE plug-a-thon in Vienna where we want to do further testing on the ballot version of the IG. In July and August, we'll process ballot comments, and we plan in August, early September to publish our first publication. So this is what the IG looks like. I was told by Michael the audience today is a mix of people that know FHIR and people that do not know FHIR. So I scoped the presentation to cover a little bit of both. So an HL7 IG is basically a web page that contains text and formal artifacts. On the top of the web page, there is a set of menu items where are basically shortcuts to the most important elements of the implementation guide. In the case of the imaging spec, there's the home will take you to this page shown on screen and allows you to basically see what the scope of the presentation is. We are working on actors and transactions page, similar to IG specifications, to provide a little bit more background on where to use. Too bad we didn't finish that in time for the ballot, so this section is currently empty, but we're working hard to fill it. We have a section on indicating how this specification maps on the requirements that came out of the extended EHR project. More on that later. We have a section on the imaging manifest, the imaging report. Those are the two artifacts defined in this specification. Every FHIR IG has an artifact page which contains the formal definition of all the data elements defined in this IG. So this direct link to that is on the artifact page. And we included a section on design considerations to give people some feedback on why we made certain choices. Besides the menu entity, you can also go to the table of contents, which basically allows you to read the IG as a normal document. Sometimes this is useful, sometimes the menu item works better. I find reviewing based on the table of contents more useful, but it's up to you of what entry point works best for you. But I want to indicate that this is possible as well. I talked, say there is a major part of specification that's based on the extended EHR logical model. I included a picture of it over here, and you can see it consists of many different data elements. And what we did, we looked at all those data elements and said, well, if I want to present this data element in FHIR, where will it go? So we took profiles of all the FHIR resources we are using. And a profile in FHIR is basically saying the FHIR resource we're using, say patient, these are the elements that we're using. And if some element that or some data element that we need is not there, we define an extension and in the profile indicate this is where the extension goes and this is why it's needed. Then we created a set of resources called concept maps, which is a FHIR resource allowing to indicate the relationships between two things. And for each logical model in the extended HL model, basically each class there, we have a concept map that says the data elements in this logical model, this is how they are mapped to FHIR. This allows you to take a look at the logical model and see where do those concepts go, and allows extended HL to check whether we appropriately reflect the data elements they are requiring us to include. So basically, this is a mapping of the requirements. Before I go into manifest and report, a little bit of background on how imaging works. If you look at the typical imaging workflow, the patient goes to one of the imaging modality, an X-ray or an MR or an ultrasound, and an imaging data is generated. This data is stored in a specific hard disk storage solution called a PACS, Picture Archive Solution. And it's stored in a structure called an imaging study. Later, the imaging study is read and retrieved by the radiologist, and he creates a report out of it, where he says, this is what I see on the image, this is what I recommend, this is what basically my conclusions are from the report, from the study, and we call this an imaging report. The imaging report typically doesn't go back to the PACS, but is stored in the radiology information system for the EHR. So the two documents, and this specification defines documents, produced by this defined by the IT, reflect those two uses. The information that's stored in the PACS is represented by what we call an imaging manifest. The report generated by the radiologist is what we call an imaging report. The manifest intends to provide information on what is in the imaging data and also provides you with the information on where to retrieve the information directly or to launch a viewer that allows you to take a look at the images itself. The imaging report holds the information why the report is made and what the results are. Let's take a further look at the imaging manifest. The main resource in the manifest is the imaging study. This is a FHIR resource that describes what the content of an imaging study is. And in Dicom, an imaging study consists of a set of series, and each series consists of one or more instances. Instance you should look at as a single picture, and if there are multiple pictures, then you basically can go through them in a row or more like a movie. And it allows you to basically take a look at different slices through the body. Besides this base information, also information on the patient is present. This is not included in the image study resource itself, but a separate patient resource. Information on why this order was made is stored in an order resource, a FHIR called service request, and it contains a specific number, known in the Dicom as the ascension number. It identifies the order this study is related to. Provides information on the procedure used to create the imaging device, basically what X-ray, CT, ultrasound, whatever was used to create the image. And then to endpoint resources. The WADO endpoint allows you to use a HTTP GET call to get direct access to the Dicom information, or to a rendered version of the Dicom information, e.g. like a JPEG, so you can easily include this in your application. And like you said before, the other alternative is a viewer. We use the IED specification for that, but allows you to launch a web-based viewer that shows this imaging study. In order to transfer all this information as a document, we defined a profile on what FHIR calls a bundle, which is a set of bundled FHIR resources. And this bundle together, we can share in a document-based sharing infrastructure, which is outside the scope of this presentation. The second main element in the IG is the imaging report. This is the thing the radiology produced. Again, it's a bundle of a set of resources. And the two main resources there are the resource diagnostic report, represents a formal representation of the data in the report and points to all the structured data directly, and possibly also to a rendered version of the report. It also points to a FHIR resource called composition, which is a FHIR way of representing how the document contents look like. It contains header information that points to patients, the service request, and those kind of things, but also contains a set of sections. And I will go to each of them in more detail. The first section, called imaging study, provides you information on the imaging studies which are basically reflected or talked about in this report. The second section is order, and that provides the information on why this study was done, and also background information on the specific reason the referring physician ordered this study to be done, basically. The section on history, which can contain relevant patient history of the patient, which is relevant to understand the report. There is a section on procedure, which points to the imaging procedure, similar as the one in the manifest, but this typically provides a little bit more detail. It points to the device that's used to make the image, but also can point to anything that went wrong or was used during the procedure. So if medication was used in the procedure, this is where you find it. Typically, medication used in an imaging procedure contains contrast fluids. Sometimes some things goes wrong during an imaging study. Contrast fluid may cause an allergic reaction or something else went wrong, and these are documented in adverse events resources which are pointed to from the procedure and reflected in the procedure section of the report. Radiologists have the tendency to look at studies and then compare them to similar studies in the past to show basically what they're seeing. So there's a separate section in the document that says these are comparison studies we used in creating this report. Then, in order to provide recommendations, typically things are measured. Most commonly, these are things like sizes of organs in ultrasounds or cancer blobs in your body, in CT and others. And these are present in the finding sections and are represented as observations we call and represent with the profile called IN finding. And also here, you have the option of indicating key images out of a large set of images that are in the study that are most relevant for the report and shows the best way why the radiologist made certain recommendations. Last but not least, there's the impression section where he says, this is what I found. For example, lesion is this size, or you have or have not a break in one of your bones. And he might include also a section on recommendations where he provides recommendations to the clinician on what to do next. Next to these resources, of course, also references to the patient, the practitioner that did the study and wrote a report, and the organization in which this report is being created are included. So, how is this represented in FHIR? In FHIR, it is represented in profiles, and you can see the list of profiles for imaging reports in this list. Let's take a look at one of them. It's the imaging report, basically the structure of the composition. And if you look at this one in the IG, you find a list of recommendations, which data elements of all the different FHIR resources are to be included in each of the sections. And later below, you also find the structure of the composition itself. Jojo, can you tell something about how people can contribute?
Turn on the I hope that you can see my screen so that I can move things forward. So your engagement is a key factor for the success of our specification. And this can be done in different ways depending on your time, your expertise, and so on. Also, following this kind of webinar and tutorial is important because the way we can get in touch with you. But providing feedback through the ballot or through the feedback collection is another way you can do that. And this is where we'll focus today. But you can also be engaged and give your contribution by attending existing hands-on event, or, as I hope, joining the meeting that regularly we have now on a weekly basis on the different topic. And happy to provide detail on how to be engaged and how to join our meeting if you need to. But let's focus on the what we have described so far. I mentioned several times all this AG is in ballot. What we are referring to, for those that are not already engaged, the balloting is the formal process that HL7 use to review and vote on specification before they are published. This is a very limited in time period, 1 month for the imaging and the base profile, will be longer for the other one due to the summertime. And the vote is restricted to the voting member. But personally, I believe that this is important, but the most important thing is your feedback. And this is the other way that is foreseen in HL7 to have the input from the different stakeholders is through the specification feedback. And also that is an official mechanism that can be used to provide those feedback about the specification. This can be done by anyone, anytime. So the balloting in Europe, in HL7 Europe, each European affiliate, including UK, as was mentioned in the chat, can have a vote, so that if you want to have some kind of impact on your national vote, and you have some strong idea of what we should be done, please get in touch with your affiliate and let's have your voice heard. In terms of specification feedback, as I was saying, there is an official mechanism for doing that. It can be done anytime, but if your review and feedback is done during the ballot period, this will have a stronger weight. That because you can influence the content before the publication, and then you can also support the vote of your affiliate because they can also refer to your comment about the specification. How this can be done? The feedback are collected through the Jira platform. So if you go to jira.hl7.org, you can find that similar interface with the Jira software, with several menu items, and with the create button. If you click on that create button, and in the link that is in red there are all the detailed instructions on how the feedback can be provided. But just to be short, you can click on the create, and that windows, that form is shown, and you can put your comment for specific version of the specification. In order to do that, you need to be registered in the Jira. If you click in Jira software, there is the instruction to do that. But anyone can register, so it's not a closed tab. Just to give some simple instruction, if when you go to the create in the form, you can see the project, you can leave FHIR specification. This means that are comments that are related to FHIR. Then you can select a different kind of issue type. Change request, you are suggesting a specific change. I don't like the solution that you have done, or please, you are using that value set that should be different. Any comment or any change you can propose on the specification. Then there are the technical correction that are referring to the typo, so or technical fix. And then there are other two kind of comment or feedback you can provide. You can use question, but I strongly suggest to use chat.fire.org to do that and not to use the Jira, because in chat.fire.org you can have a more immediate reply to your question. And then you can use the comment to provide, not to request a change, but to help us to improve in general the specification. Then in order to identify the specification, you can go and to write just EU in the specification row, and then you can see a list of different specifications, and it's clear that if you need to comment on the imaging, you can select EU imaging study report. If you need to comment on base, you can select EU base and core, release 4 and release 5, and then you have a place where you can put your comment. And you can provide see more detail on the link that has been put in the chat now. So this is just an overview of the thing that I've already said. So, but based on core profile, we are now in the ballot phase. We'll end in June 13. Please send your comment by that date, but you can continue to do that also later. But if you do sooner is better. Lab report is already published, the first standard for trial use, but also in that case, you can still put your comment if you have suggestion or improvement or things that need to be fixed. And for the other, the data are there. As I mentioned before, FHIR report and prescription, the ballot will start soon, and the patient summary is now in progress. Before giving back the floor to Michael, I would like to mention the HHR stakeholder consultation. It's not a case that the FHIR ballot on prescription and dispense and the stakeholder consultation on prescription will start in the same date. That because the HHR 06.2, that is about electronic prescription and electronic dispensation, include and refer the HHR logical model, so that if you need to comment on the logical model, is not so the logical model of HHR are not the subject of the ballot, but we are still glad if you have comment that you want to give on that, because are not things that are developed by the HL7 Europe group project. But the Title 6.2 include also the HL7 Europe FHIR AG. So there is that target stakeholder consultation that will start June and will end mid of September. This is a target stakeholder consultation. So if you want to be engaged, that there is the link where you can offer you volunteer to review and provide feedback about that deliverable. You don't need to, if you are going to comment through on the HL7 Europe FHIR AG through that path, then you don't need to repeat, because we will consolidate the comment about the FHIR AG, also those that will come from the stakeholder consultation. However, if you have not been selected for reviewing that, then you can still submit your comment via HL7 Europe. You can get in touch with us. We can identify if you are, let's say, properly. So if you can be part of this stakeholder consultation, I believe that you are. But and then we can share with you the 6.2, and you can send to us your comment, and we will collect all of them and make them available to the XTHR project. So this is just to describe that it's a more complex project, and we are working, all these different initiatives are working together in order to achieve the best result. Having said that, I give the floor back to Michael for the last part of the session. Thank you.
Good. Thank you so much. And I think, Giorgio, I think you again, and like all speakers, Line, Bas, and of course, Giorgio, you've beautifully stuck to your allotted time. I invite you to come back and turn on your video here, because we're now going into Q&A, and we have a few minutes to answer your questions. I haven't seen your questions here or any interactions. We had a lovely side conversation on a couple of issues in the chat, which, by the way, is not going to be recorded, is not going to enter into the permanent record, so to speak. So I won't touch on these here. If you'd like to be leave an imprint, or if you'd like to raise your question, right now is the perfect time to do this. There's a lot of work going on the EHR Exchange format, on the specifications that will guide how we in Europe will exchange health data, both across borders, but then also between providers and between systems. And through the Brussels effect, that will probably become quite powerful also beyond the borders of the EU, beyond the borders of the electronic, the European, the EAA, which of course the European Economic Area, EEA, thanks to the Brussels effect, will probably have quite some impact here. So if you are in a position where you want to participate, join, contribute to these specifications, would like to make them better, would like to make them more robust, please contribute. Giorgio has already highlighted how you can contribute to the XTEHR presentation, to the XTHR specifications. And of course, we've also spent the entire webinar discussing how you can contribute to HL7. So while I'm blabbing here, I'm trying to encourage you to maybe gather your courage to raise your hand. But if we've answered all our questions, all your questions, then of course we will also take that away as a nice sign from you, and we'll leave this. We'll feel good about ourselves. I did put in the chat here a request if you would like to leave some feedback on this webinar in general, and if you have any questions that you felt like we should have addressed in more thoroughness, so to speak, let us know. Would any one of our speakers maybe ask a question of the other speaker? This is now the moment to do it, because we have a couple of minutes left, but I think we've covered quite a lot of ground. And with that, I'm also very happy to give you back some time, but please spend a minute and on the online form. And this here is my closing slide here. So I want to remind you again that we're putting all the link to the recording and to the slides on HL7.tv very soon, so you will have access to all of the content that was shared today. If you would like to meet us, Giorgio and many other HL7 Europe colleagues will be at the Plugathon in Vienna. So that's the IHE Connectathon, and we will be there as well, because of course, as we try to communicate we're joined at the hips with other standards initiatives, and this is an opportunity where the community gets together. I put here 2 links for HL7, how to become involved. I highlighted in the chat how Line and how Bas are volunteers who are volunteered, so to speak, by their organizations, sponsored by their organizations to contribute to HL7, HL7 FHIR, HL7 Europe. If you are in a position, if your organization would like to sponsor, please click on Get Engaged, and we will find ways to make use of your time and your expertise. XTEHR, I post again the link that Georgia has already posted. And if there's nothing else here, then please stay in touch with us. Follow us on LinkedIn and social media. If you've heard about this webinar beforehand, it's likely because we posted on it on social media. That's very much our channel of choice these days. But we also have a newsletter, and we would like to encourage you to also subscribe to our newsletter if that's your thing. And thank you, Bas, for posting that link in the chat here. We'll make key contributions to the chat also available to you in a follow-up message. So we'll post the links and resources also in an email that you will see from me when I share the link to the recording and the slides. I see a raised hand here, and I would like to encourage, so John George, our side conversation here, I'm going to allow your microphone, I'm going to allow your camera, and yeah, please unmute and raise your question. John?
Hi, I put my camera on. I'm just curious, is anyone planning to move to FHIR version R6 before the US core moves? I've heard the US core is planning, I think, 2028. Ourselves in the UK, we're mostly using FHIR version R4, and we're doing stuff like backporting from R5 into R4. And just wondered if anyone is thinking of moving to R6 when it gets released. I think it's next January.
Dodo, unmute yourself.
I was trying to, okay. Aaron, so on the that discussion about the FHIR version, what we said in the technical coordination team, and also in some open conversation that we had also in Madrid in the HL7 working group meeting, is that we try to offer a solution covering the different version of FHIR. That is why we are trying to have the guide for FHIR Release 4 for the member state for the country that are working on Release 4, but also using Release 5. And the plan is to move to also to offer a solution on Release 6 when the version will be officially published. Obviously, this is part of the journey. It is not a thing that will happen immediately, but we are not, as HL7 Europe, focusing on a single version of FHIR because different member states have a different approach and policies in that. I don't know if Line and Bas would like to add anything on that.
Yeah. Short add, John. The FHIR Release 6 will be published for ballot in January. It means it probably will not be out before the end of that year, or because HL7 progress requires that all ballot comments have been processed. If they're negative, there is required to be a reballot on those topics. So I don't think R6 will be out next year, but probably early the year after.
Okay.
And also from HL7 Norway, I can add that we've been using R4, and we have decided to probably stay on R4 before we go for R6 when that's released. And not going for R5 at all until that.
Okay, thank you.
Leapfrogging. Excellent. And I think with that, we're at the end of the hour. I would like to thank again, a big shout out to all speakers, Bas, Jojo, Line, last but certainly not least. Thank you so much for your contributions. Thank you for your reactions and your participation. Please complete the form, the feedback form that I sent, and we wish you a wonderful rest of the day, and we hope this has been helpful to you. Thank you so much, and there will be more. Bye-bye.
Thank you. Bye, everyone.
Bye-bye.
Bye.
Thanks. Bye.